Hello and welcome to another episode of Podcast DX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis.
I'm Ron.
I'm Jean. Marie.
She forgot. And I'm Lita. Collectively, we're the hosts of Podcast DX. On today's show, we are sharing some information about the field of diagnostic radiology and possible errors within that field.
Over the past 128 years, the medical field of radiology has blossomed, and it's difficult to picture the field of medicine today without radiology. The term radiology comes from the Latin term for ray and the Greek suffix ology, meaning study. The three main branches of radiology are diagnostic radiology, interventional radiology, and radiation oncology. Today, we're focusing, as you said, on diagnostic radiology.
That's right. Mm-hmm. A recent article in HealthWorks Collective stated that diagnostic imaging, commonly referred to as radiology, is one of the most revolutionary innovations in the medical world. Radiology has revolutionized how physicians and patients view health and diseases. Radiology allows medical professionals to peer into the interior of the human body that is living without having to cut it open. Oh, joy. The benefits of radiology to health and life in general cannot be overestimated. In fact, without radiology, it would be impossible to recognize most contemporary medical fields.
And we aren't just talking about X-ray. We also need to include magnetic resonance imaging, which most people know as an MRI, which is a type of scan that uses strong magnetic fields and radio waves to produce detailed images of the inside of the body. A scanner, an MRI scanner, it's a large tube that contains powerful magnets, and you lie inside the tube during the scan. As well as imaging, often called a CAT scan, computerized tomography, otherwise known as a CT scan, combines a series of X-ray images taken from different angles around your body and uses computer processing to create cross-sectional images or slices of the bones, blood vessels, and soft tissues inside your body. CT scan images provide more detailed information than the plain X-rays. Lastly, PET scan, which is positron emission tomography, it's an imaging test that can help reveal the metabolic or biochemical function of your tissues and organs. The PET scan uses a radioactive drug, which is called a tracer, to show both normal and abnormal metabolic activity. A PET scan can often detect the abnormal metabolism of the tracer in diseases before the diseases actually show up on other imaging tests, such as the CT, the computerized tomography, and the MRI, the magnetic resonance imaging. These details were pulled from the Mayo Clinic website, which will be on our website.
Okay. And we're not going to be going into some of the other types of scans, but there's many different types of scans. There's ultrasounds, mammograms, DEXA scans, other myelograms, and evaluations of joints. And what do all these scans have in common? They need to be read or interpreted by a specialized doctor, often called a radiologist.
Or a computer program.
Yep, your radiologist and or computer program.
I read an article from MIT dated February 2016, that was pre-COVID, that explained the latest AI or artificial intelligence program called Avicenna. Avicenna, okay. Created by IBM, that can identify anatomical features and abnormalities in medical images such as CT scans, and it also draws on text and other data in the patient's medical record to suggest possible diagnoses and treatments. Avicenna is intended to be used by cardiologists and radiologists to speed up their workload, reduce errors, and is currently specialized in cardiology and breast radiology. It is currently being tested and tuned up for using anonymized medical images and records for the future use.
I think you can request it now. It has it available, and you can try it out
Okay.
on their website.
That's interesting. Does the artificial intelligence program, does it reduce the incidence of medical errors?
Well, the only non-biased information I could find was an article on or in PSNet, the Patient Safety Network, dated January 2020. In that article, they stated medical imaging is one of the most promising areas for the application and innovative use of AI. The use of AI in radiology has the potential to improve the efficiency and efficacy of medical imaging. Its use may also alleviate some of the burden and burnout experienced by radiologists who feel overwhelmed by the proliferation in the volume of imaging studies performed and unable to devote sufficient time to providing meaningful patient-centric care.
That sounds very promising. The error rate of radiology reporting is about 4% worldwide on average, and the number of interpretive errors comes out to be about 40 million per year.
Wow.
And most of these may be minor, or if significant, they're found and corrected quickly enough as to not cause serious impact on the patient's health.
Okay. Well, I had a recent radiology mishap myself, and Jean, you had one way back in 2000.
Mm-hmm.
How about I talk about mine and then you talk about yours?
Great. Sounds like fun show and tell.
When I had my recent CT scan to see what's going on with my partial fundoplication, the radiologist mentioned in their report the gallbladder is present. And I knew that was wrong.
Why?
Well, I thought that was wrong. So I went for a follow-up to my surgeon, and I asked, and he confirmed the gallbladder is no longer part of my anatomy. When I mentioned the radiology report, he was as surprised as I was and said he would get it fixed, but it's not fixed yet.
Yeah. And my surgery was delayed for 4 years because they said everything was fine, and it turns out everything wasn't fine.
Wow.
And when I had another MRI, they found the problem right away, and I was immediately scheduled for surgery.
So I'm sure both of you might be interested knowing that recently I read an article in the National Institute of Health's National Library of Medicine.
That's a mouthful.
It is a mouthful. Anyways, guess what the article was entitled?
What?
It was called Errors, Discrepancies, and Underlying Bias in Radiology with Case Examples, a Pictorial Review.
Oh, a pictorial review. Sounds like they're doing Rotten Tomatoes. You know, the site that gives you a tomato meter score for your
I don't think
film
you've
and
ever
television.
gone
Okay.
to Rotten Tomatoes before.
Well,
Okay, no. Not reviewing films or TV, just the radiologist. And this report states that there are 12 subgroups of radiological error types. And if you don't mind, I'll go over each one of them.
Yep, but can I do the first one?
Sure.
Okay. So the first type is complacency, and the finding is identified. So whatever's going on is identified, but attributed to the wrong cause.
Interesting. The second one is faulty reasoning, which is a finding identified as abnormal, but attributed to a wrong cause.
Okay.
We also have a lack of knowledge, which is finding identified, but attributed to a wrong cause due to, guess what? A lack of knowledge.
It's not good.
No. The next one is underreading, and that is a missed abnormality that was appreciable in retrospect, meaning they should have found it.
Mm-hmm.
Oh, look at the next one. Poor communication. That's finding identified as abnormal, but poor communication to other relevant clinician.
Yeah, so they found it, but then they weren't communicating the problem to whoever needed to that information in order to intervene.
That's exactly right.
Okay.
And then we also have technique,
Okay.
and that is an abnormality which was not identifiable, even in retrospect, secondary to poor technique.
Okay.
Type 7 is prior examination, which is a failure to review previous imaging results and missed findings.
Okay.
Then we also have history, which is finding missed due to incomplete clinical information.
Yeah, they weren't looking in the right place.
Exactly.
Yeah. Okay.
The next one, type 7, is prior examination, which is failure to review previous imaging results and missed findings. The 8th type is history, which is finding missed due to incomplete clinical information. That's never good.
Nope.
Location, finding missed because it was outside of the region of interest. They looked in the wrong spot.
Mm-hmm.
Then type 10, satisfaction of search. And this is a failure to find a subsequent abnormality after the initial abnormality was detected. Type 11 was complication, which was most often of
Right,
interventional procedures.
which we're focused more on diagnostic
Today, yeah.
today.
Right.
Yeah.
Okay, I wanted to just
Yeah,
But it
it's
still
still
has
there.
errors.
Yeah.
Right.
Right.
And then finally, we have the satisfaction of the report, which is over-reliance on the prior report. So
Okay.
if the prior report was
Had my gallbladder. This one should too.
exactly,
There was a surgery in between that took it out, but okay.
there's more, but these are the main ones.
Okay.
And it's really talked about the different biases that can affect the way it's read.
Right. And the problem is once incorrect data is reported and is ratified, and it's perhaps stated as like this wasn't a worrisome issue by a clinical care physician, then it's unlikely to be corrected by anyone else.
Right.
And there are some other red flags that should, if you look out for these things in your report, and if you don't find them or if they're incorrect, you might want to ask your healthcare provider about a second opinion. Make sure that the radiologist's report clearly states what they are looking for. If you have pain in your hip, you want them to be focused on that area. Make sure the report clearly states whether or not they found something. If it says that they weren't able to find anything, or it's inconclusive, then you might need to
Get that second opinion.
Yeah, get further information about that, what happened. Make sure the evaluation clearly states whether the finding is definitive or ambiguous. If they're not really sure about it, do you need additional imaging? Do you need a second opinion?
Mm-hmm.
What's going on?
Okay. Well, now that we discussed the basics on diagnostic radiology, I think our listeners have a better understanding of the process.
Potential errors?
Yeah. And the potential errors, yeah. In order to better serve our guests and listening audience, we are now working as an affiliate with a major medical supply warehouse located here in the United States. You'll find our affiliate links on our website. Our goal is to tailor specific medical supplies and equipment based on individual diagnoses to make it less stressful than looking through an entire catalog for what you might need. We are open to your suggestions and will open our offerings based on what you, our guests, and our listeners find helpful. But for now, let's go back to the radiology area.
Okay. Well, there's a lot that can go wrong in radiology. And I guess the question is, what can you as a patient do about it? And when do you know something is not quite right?
Okay, well, the diagnosis and prognosis of your disease or diagnoses and the path of treatment are strongly dependent on your imaging reports that include MRI, magnetic resonance imaging, CT, computerized tomography, mammography, ultrasound, X-ray, or computed radiology.
Okay.
But while the most experienced doctors and physicians can make mistakes in diagnoses once in a while, getting a second opinion on your radiology read from specialized radiologists is greatly beneficial because it reduces the chances of misdiagnosis by almost 90%.
Okay.
Makes
A
sense.
second opinion provides peace of mind, makes you aware of all possible treatment options, and ensures that you have selected the best one. If you decide to avail radiology second opinion services, a specialized radiologist can look through your imaging reports, MRIs, X-rays, CTs, etc., to analyze whether invasive and potential harmful treatment is really necessary in your case. Getting your radiology report cross-checked by a second radiologist helps to eliminate human error. In many cases, even the doctor requests the patient to get a second opinion, and it can often result in changes in diagnoses and treatment.
Here, let me jump in here for a minute, Lita. According to the National Center for Policy Analysis, approximately 10 to 20% of medical cases are misdiagnosed. That's a lot.
Yeah.
Yet, there's another report, and that states that 28% of 583 diagnostic mistakes were life-threatening and had resulted in permanent disability or even death. A recent report from Quantia MD had shown that almost half of the 6,400 physicians that they had surveyed had encountered diagnostic errors that included missed, late, or wrong diagnosis at least monthly. That's a lot. And about 2/3 of them admitted that up to 10% of misdiagnosis has resulted in patient harm. And according to a study released by the Journal of Patient Safety, as many as 440,000 people die from preventable medical errors in hospitals each year. The interpretation error rate for abnormal radiology scans is as high as 33%. That's pretty significant.
Steep.
Radiologists over at the Johns Hopkins, who provide the second opinion on CT scans and MRI studies for brain, they found that in a study that 7.7% had serious discrepancies.
Wow.
And when the final diagnosis was made following pathology reports, clinical assessments, and other imaging follow-up, the second opinion was right 84% of the time. Let me add this, too. In an analysis of 656 imaging exams by radiologist Dr. Young W. Kim and colleagues, which was collected over an 8-year period, 1,279 errors were found. And of those, 42% were caused due to underreading, while a failure to comprehensively examine anatomy after seeking abnormalities which were relevant to the primary diagnosis comprised 22% of those errors. I know that's a lot of
Numbers.
stats, but it's pretty significant in what we're talking
Right,
about.
right. I mean, so
And what you hear about in the news, or what I hear about more in the news, is people saying, or medical professionals saying, don't get like a complete body scan because they're going to find things that are asymptomatic and don't need intervention. But what you're saying is most of the errors that result in the need for pathology later on are from underreporting.
yeah. I think I'd rather have a second report and have it over-reported.
Yeah, over too much detail. I don't know. You got to find it. There's a fine line there, but yep.
I guess if you don't know what you look like before,
Right. Well, that's another thing you want to
baseline.
Right. You need and they need to monitor some things over time. There are groups out there that will do second opinions, and there's places like the National Diagnostic Imaging, Doc Panel for patients, and others. And we'll put links for those on our website, but you can always ask your healthcare provider who they recommend going to for a second opinion. And they may have someone that they know who can do a second opinion. And they may themselves also want to read the actual film to see if they catch something that wasn't in the radiology report.
Sounds good. So I think we're ready to wrap this one up.
Sure.
Yeah.
All right. If our listeners have any questions or comments related to today's show, they can contact us at info@podcastdx.com.
And if you have a moment to spare, please give us a review wherever you get your podcast.
And as always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions that you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something that you have heard on this podcast.
Till next week.